Welcome to this presentation on the introduction of artificial intelligence tools into the clinical and non-clinical workflows in the NHS Breast Screening Programme. My name is Dr. Niamh Lennox Chhugani and I'm the Research Director at Tau Health Research and Implementation. This evaluation is part of the NHS Test Beds Wave 2 programme and has been conducted in collaboration with EMRAD, the East Midlands Radiology Consortium, which is focused on the innovative delivery of radiology services across 7 trusts in the East Midlands. This evaluation is examining the use of a product called Niamh, which is an artificial intelligent product that can be used as a second reader in the breast screening programme. And a second product has yet to be developed, which can be used by breast screening programme managers to help with the demand and capacity management for the operations of the breast screening service. In addition, there will be a number of other outputs from this project related to the process of delivering innovative AI solutions in a healthcare context. The evaluation that I'm going to present today is focused on one part of the whole project evaluation. And the questions that we're looking at particularly here look at the perceptions of the staff within the breast screening programme on the potential for the use of AI tools to support their operations and clinical decisions. We will also be looking at whether these attitudes are changing over time, over the course of the project, and what are the perceptions of women in the general public. We've employed a number of methods over the course of the evaluation, but the focus today is on the survey method which we have used to gather data to date. So 3 surveys were conducted in the latter part of 2019 and early part of 2020. The groups covered were clinicians, so these were radiographers and radiologists and nurses working within the breast screening service. Non-clinicians were administrators and managers working within the breast screening service and members of the general public. You can see the response rates here for each of these groups. When asked to rate their agreement with the statement that AI has a positive effect on society, you can see that clinicians were much more likely to be positive about this and agree with this statement than non-clinicians, with the public somewhere in the middle. Only clinicians were asked about their comfort about using AI as a second reader of mammograms, and over half of them stated that they were comfortable. But when asked for more detail, most clinicians said they wanted to see evidence from prospective clinical trials. When asked if the use of AI in breast screening would have a positive effect on women's experience, more clinicians than non-clinicians were of this view. And when asked whether they would have a positive view of AI in breast screening overall, and this question was directed just at the public, almost half said they would be. And if we look at our conclusions overall at this stage, it's fair to say that clinicians are overall more optimistic about the introduction of AI into clinical pathways, but they do want to see the evidence from clinical studies. Non-clinicians are more sceptical, and younger women in the general public are more open to the use of AI, but generally women see this as almost inevitable. And overall, clinicians have a greater awareness of AI and how it could be applied in the breast screening programme. Over the summer of this year, we will be conducting further qualitative and quantitative data collection and analysis before publishing our final report in September of this year. Thank you for listening, and if you have any comments or questions, please put them in the comment box below this video and we'll read and respond.